How's it going, everyone? I wanted to cover a quick question that tied in integrations from biology and psychology, the type of integrative question that the MCAT really likes to test you on test day. So pause this video and try it on your own, and then we'll go over it. So this question is stating, antipsychotics are a class of drug that primarily inhibit dopamine activity in the central nervous system. Which of the following is a likely side effect of long-term use of antipsychotics? So to know what's going on in this question, we have to know a little bit about our dopamine pathways, of which there are 4 that you need to know for test A, which are going to be the mesolimbic pathway, the mesocortical pathway, the nigrostriatal pathway, and the tuberoinfundibular pathway. Now, in the context of schizophrenia, to simplify things for the MCAT, the mesolimbic pathway is going to be largely responsible for some of the positive symptoms of schizophrenia. So we're thinking things like hallucinations, delusions, etc. Mesocortical is going to be more responsible for the negative symptoms, so lack of emotional expression, lack of motivation, etc. Nigrostriatal is going to be involved with movement, so not necessarily related to schizophrenia, except that could be related to some of the adverse reactions of medications used to treat schizophrenia, which this question isn't necessarily covering. And then tuberoinfundibular, and that's dopamine's connection to prolactin. So if we remember our anterior pituitary pathway, dopamine actually inhibits the release of prolactin from the anterior pituitary. So this question is asking us, which of the following is the most likely side effect, okay? So A, increased frequency of positive symptoms. That's actually the opposite of what's going to happen, because if we're inhibiting dopamine, we're inhibiting that mesolimbic pathway. We're going to see likely a decrease in those positive symptoms. Now, B, increased frequency of negative symptoms. Again, less likely. Antipsychotics actually don't have much of an effect on negative symptoms of schizophrenia, although there is a lot more nuance to that clinically. However, if we were to expect anything, we might even expect a decreased frequency, which actually isn't the case. It isn't really decreased or increased either way. Increased likelihood of developing severe addiction. Again, that's that reward pathway with the mesolimbic pathway. Again, that's actually the opposite of what we're going to think. And then D, enlargement of breast tissue in male patients. That's actually a true side effect of some antipsychotics, some more than others, because we're actually inhibiting the dopamine that's inhibiting prolactin. And if we inhibit an inhibitor, basically we get an increase of whatever we're looking at. So we get an increase of prolactin, an increase of the development of the mammary tissue, some of which males actually have and is prolactin responsive. And we can see something called gynecomastia, or enlargement of breast tissue in male patients, which can be a side effect of antipsychotics.